Dental impression materials made easy. First, master the big split. RIDE rule. Rigid, irreversible hydrocolloid, duplicate hydrocolloid, think agar or reversible hydrocolloid, E for elastomers. A simple exam version is rigid versus elastic. Rigid, impression compound, zinc oxide eugenol, impression plaster, waxes. Elastic, agar, alginate, polysulfide, condensation silicone, acelicones and polyethers. This broad split is standard and is the first thing to lock before doing anything else. Next, the easiest classification mnemonic. CABSA plus 4 elastics. Rigid, which is compound, plaster, ZOE, waxes. Elastic, agar, alginate, polysulfide, condensation silicone, addition silicone and polyethers. That gives students a repeatable list they can say daily. Rigid materials become rigid after setting and are mainly suitable where undercuts are absent. Elastic materials recover after deformation and are used when undercuts or more detailed reproduction is needed. Next, the most exam-friendly family tree. A, which is the rigid materials, used in edentulous mouths or where undercuts are minimal. Impression compound. Thermoplastic, softens on heating, hardens on cooling. ZOE paste, good for edentulous final impressions. Impression plaster, rigid, brittle, old school, yes, but classic exam topic. Impression waxes, limited precision, mostly special uses. Elastic materials, use where there are undercuts or finer details is needed. Hydrocolloids, agar-agar, reversible hydrocolloid. Alginate is the irreversible hydrocolloid. Elastomers, which are polysulfides, condensation silicone, addition silicone, polyethers. The one-line trick to never forget hydrocolloids. Agar again, alginate once. Agar, which is the reversible hydrocolloid. Alginate, which is the irreversible hydrocolloid. Why it works? Agar-agar changes by temperature and is reversible. Alginate sets by chemical reaction and does not revert back. Next, the simplest way to remember the rigid materials. Rigid is equal to no undercut, friends. If the impression has to come out through an undercut, rigid materials may fracture or traumatize the tissues. That is why rigid materials are mostly used for edentulous impressions or selected non-undercut uses. High yield rigid memory pack. Compound is equal to thermoplastic. ZOE is equal to edentulous final impression. Plaster is equal to brittle rigid material. Wax is equal to limited special applications. Next, the easiest way to remember alginate. Alginate is equal to cheap, easy, quick, pour quick. This is probably the single most tested material in basic MCQs. Alginate revision formula. Type, irreversible hydrocolloid. Nature, elastic. Best use, preliminary impressions, study cast, orthodontics, antagonistic cast. Biggest weakness, dimensional instability, so pour early. Mnemonic, alginate is Alg. A alginate, L low cost, G general preliminary used, I immediate pour. Error trap, students forget syneresis and imbibition. Easy memory, alginate hates waiting. Syneresis loses water, shrinks. Imbibition gains water, swells. Both distort the cast, which is why prompt pouring matters. The elastomer shortcut students actually need. Order from old to modern. Polysulfide, condensation silicone, addition silicone, polyethers. Mnemonic, please come after practice. P polysulfides, C condensation silicone, A addition silicone, P polyether. All four are elastomeric impression materials and are classic crown and bridge or fixed prosthodontic question territory. The easiest way to differentiate the elastomers. Polysulfide, think, older, messy, bad smell or taste, good tear strength and long working time. Memory, polysulfide is powerful but unpleasant. Condensation silicone, think, easier than polysulfide, alcohol byproduct, more shrinkage, poorer dimensional stability than acelicones. Memory, condensation is equal to contracts. Addition silicone, think, most popular high accuracy, answer, excellent dimensional stability, no condensation byproduct, called PVS. Memory, addition adds marks. Polyether, think, stiff, accurate, naturally more hydrophilic than silicones, harder to remove in the deep undercuts. Memory, polyether is equal to precise but punishing. These broad property differences are well established in the impression material literature and educational reviews. Next, the highest yield exam comparison. Best for preliminary impression, alginate. Best classic edentulous final impression, ZOE paste. Best high accuracy fixed prosthodontics impression. Usually think acilicones or PVS or polyethers depending on what is appearing. Memory, alginate for starting, ZOE for edentulous finishing, PVS for precision. The exam trap on hydrophilicity. Students often get confused here. Quick exam rule. Polyether is equal to more hydrophilic than many elastomers. Acilicones or PVS, excellent stability, but traditional teaching often contrasts it with polyethers on hydrophilicity. Memory, polyether likes water more. The trap on setting reaction. Physical settings, impression compound, waxes and agar-agar. Chemical settings is alginate, ZOE, plaster, elastomers. This is a very common direct MCQ. Mnemonic, hot things harden physically, paste and powder reacts chemically. Now comes silly mistakes. Mistake number 1, confusing agar and alginate. Fix agar again, alginate once. Mistake number 2, thinking alginate is dimensionally stable for long. Fix pour early. Mistake number 3, mixing addition and condensation silicones. Fix condensation contracts, addition is more dimensionally stable. Mistake number 4, using rigid materials mentally in the undercuts. Fix rigid is equal to no undercut friends. The 20-second oral revision formula. Say this daily. Let the chanting begin. Rigid is compound ZOE plaster wax. Elastic is agar, alginate, polysulfide, condensation silicone, addition silicone, polyethers. Agar is reversible. Alginate is irreversible. Alginate preliminary and pour early. ZOE is edentulous and final. PVS is precise. Polyether is accurate but stiff. If a student can see this without looking, the topic is much more easier for your MCQs. Hope that helps. Don't forget to save it. Don't forget to share it. Let everyone benefit. Take care.